Good afternoon. Welcome to Health and Living with me, Shiao. For couples trying to have a baby, there is nothing more joyful than news of a pregnancy. But for couples who have tried repeatedly for a year or more, it can feel increasingly bleak as they go through the bad news and the emotional turmoil month after month. So today we're going to explore how infertility can impact the mental health of couples, especially for women who do, I believe, bear disproportionately the emotional burden. And joining me to discuss just that is Dr. Navdeep Singh Pannu, Medical Director of TMC Fertility. Dr. Navdeep is also President-elect of the Malaysian Society of Assisted Reproductive Technology. How are you today, Dr. Navdeep?
I'm good. Thank you very much. I'm great.
Yes, and our lines are open. So if you are in this boat, you are struggling to conceive, or if you'd like to share your experience with us, we'd love to hear from you. You can call us at 0377332900. You can also WhatsApp 018-789-8899 or tweet us at BFM Radio. Dr. Navdeep is here to answer your questions as well. Dr. Navdeep, I know that a couple is said to be struggling with infertility if they fail to conceive after 1 year of trying. And we've heard stories, right, where some couples try for even longer. They just keep trying. Now, what kind of stories have you heard from your patients?
Well, before I get into that, I'd like to first thank BFM for having me on the show.
Absolutely.
I much appreciate being given the opportunity to have a conversation with you today about the impact on fertility and mental health. So there are many couples who are affected by infertility issues, within 8 to 12% of them, and this number is gradually increasing over time. So mental health is something which need to be acknowledged, recognized, and given due attention. So I guess that's why we're speaking about it today, and hope it'll be helpful. Now, coming to your questions about what I've gone through so far and experienced, I've heard many stories of couples trying multiple times and failing. One thing for sure is that this whole journey of infertility is anything but easy. So the examples that couples go through will be like, they find all possible ways to finance their treatment options, and they go through many types of treatments. For example, time intercourse, intra insemination, IVF, which are test tube babies. Okay, so some couples achieve their pregnancy after just one time of trying, some after 2 or 3 times, and some unfortunately and sadly are not successful at all. So the mental toll in couples go through after a failed fertility treatment is tremendous,
And I can imagine that there's so much emotional turmoil, and a lot of it is probably kept to themselves. And especially as couples look at others around them, perhaps their friends or other relatives who, like you said, seem to have no problem conceiving. There must be a lot of that. What's wrong with me? What's wrong with us? Why is this happening to us? Right?
Yes, definitely.
Yeah. And you talked about couples trying all sorts of fertility treatments, and we'll talk about the financing aspect later a bit, I hope. But how long, in your experience, how long do couples actually just try other methods first, perhaps their own natural remedies, things that people advise them, before they turn to someone like a fertility specialist?
Well, generally couples have to try 6 months to a year of unprotected intercourse, and after which then they get pressured from family members or even society before they come in to see us. And lots of them, unfortunately, too, gets lots of unproven advice from a lot of people. So be trying lots of other things. For example, having intercourse when the wife's ovulating. So over 3 weeks, they don't do anything. Only at a time when the wife ovulates, they have intercourse. And that will not, get them pregnant. They should have intercourse more frequently during the ovulation time, which is day 10 to day 20 of a cycle. But unfortunately, lots of them don't do that. And sometimes some also take certain types of herbal remedies, to try to boost their chances. And some of these herbal remedies are good, but a lot of them are unproven and, will be more detrimental to them. And sometimes also lots of people get advice which about misconceptions about fertility. Many times that the woman is blamed for it, so they have to go for the test. So point to note that men, they also contribute 50% of the problem. There are statistics that we follow. Generally, 30% men problem, 30% female problem, 30% both have problems. 10% we really don't know why. So it's unknown causes. So after trying all that, eventually then they come and see us.
All right. Now, what do we not see that's happening behind closed doors? What are these couples going through emotionally? In the toll on themselves as individuals, but also the toll on the couple's relationship.
Well, when a couple starts a fertility treatment, they step into it with plenty of hope and dreams of holding their baby. But when it fails, then there's a lot of sense of loss. It's like losing a child. So this affects them both socially and personally too in their life. So lots of stress, guilt from a partner can come in. So the most important, difficult emotional consequence is the loss of control. And some of them, they have self-blame. And some even go through suicidal thoughts, unfortunately, which is very sad. And as for couples themselves, some of them have relationship problems too eventually, and have a lot of sexual problems, and their inability to conceive causes them much stress, such as depression, anxiety, and that eventually affect their libido and impact their sexual relationship among the couples. And some couples even end up separating after failed fertility procedures. So as you can see here, the mental issues due to infertility is a real factor, and it's not an issue which to be taken lightly.
And I find it very interesting that you use the word loss, and it's something that we may not think about, that it is a loss just because they haven't conceived yet. We're not talking about a miscarriage or losing a child, but it is still a loss in the fact that they just keep trying and they can't achieve what they're dreaming of. I know you said that it is the problem can stem as much from the men's side as it can from the women's. But how would you say? And I know this may be my personal bias, but I do believe that the burden is worse on women. Do you see that as well?
Yes, generally, where infertility is concerned, women undergo more stress than their male partner. And there are local statistics for this too. A study done in Malaysia in 2020 found that the level of anxiety and stress, depression also, among women going through infertility was 1.5 to 3 times higher than men. This was a study done in UITM. Okay, so the burden is also higher in women because she's the one who has to conceive and carry a pregnancy to term. So when a fertility treatment outcome is negative, the women usually blames themselves for failing to, do their job, because that's what society, feels. And also society is also too quick to blame the woman. You didn't do this, you didn't eat that kind of vitamins, what I'm saying? So, but here again, I like to stress that the problem is also 50% men. It takes two to tango and two to make a baby. Okay, so lots of times, people tend to, tell the lady to go and get checked, and men don't. But lately we do see a lot of men coming in too, along with their wives, hand in hand, coming for the treatment. So another issue is that this whole journey of infertility is usually a very lonely journey for couples. So the most important thing is that husbands and wives must emotionally support each other throughout the entire journey.
When you say emotionally support each other, what would that look like?
Well, generally, just be around, be there, During the whole process, follow your wife or to the clinic, and learn about the medication and what needs to be done. Okay, and remember the timetable. So both of them go through it together. And if one couple has a problem, for example, it's a male-related problem and a female-related problem, there should not be any blame game there, because they both want a baby. So they both have to support each other, don't blame each other, and help each other out in their respective treatments.
All right. I'm speaking today to Dr. Navdeep Singh Pannu, Medical Director of TMC Fertility, and we're discussing the impact of infertility on the mental health of couples, the kind of emotional turmoil that they go through, and why it's important to recognize the stress and distress that couples go through, and how as a couple, they can support each other, but also people around them, their family members, extended family, friends need to be supportive of what they're going through as well. So when we come back, let's talk more about going through the fertility treatment. Before this, I was actually looking at sort of that pretty much, if we define infertility as, trying and failing to conceive after 1 year of trying. So the stress that they've been going through for that 1 year. But when you do seek fertility treatment, it is a journey and a process on its own. What's happening there? What kind of support do couples need? We'll look a little bit at financial issues as well. So do stay tuned. You can call us if you have questions or experiences you'd like to share. 0377332900 is the number to call, or you can WhatsApp 018-789-8899 or tweet us at BFM Radio. We'll be right back on Health and Living, BFM 89.9. Good afternoon. Welcome back to Health and Living with me, Shiao. My guest joining me via Zoom today, Dr. Navdeep Singh Pannu, Medical Director of TMC Fertility. Dr. Navdeep is a consultant ONG and a fertility specialist. He's also the president-elect of the Malaysian Society of Assisted Reproductive Technology. We're discussing something really interesting today, not just about infertility and fertility treatments, as options of managing it, but its impact on the mental and emotional health of couples, its impact on their mental well-being, their relationship with each other as well, and how anxiety, stress and depression are real risks if their mental health is not taken care of. So do call us at 0377332900 if you have questions or stories you'd like to share. You can also WhatsApp us at 018-789-8899. Dr. Navdeep, before this, we were sort of looking at the process of trying. And then finally, a couple would decide that they need to undergo fertility treatment. They'd see somebody like you, a fertility specialist. Now, what can they expect as they go through the treatment process, be it IVF or any form of assisted reproductive treatment? And how do you help them to manage their expectations and the anxieties that come along with it?
Well, there are many types of treatment options available, from options which are less invasive to more invasive. But before we go into treatment options, we generally try to determine the cause of the infertility, and we try to individualize the treatment option based on the kind of problems that the patients have. The treatment options can vary from, time intercourse, which is the least invasive, to IVF, which is the most invasive, or test tube babies. When it comes to emotions, the women get affected tremendously because of the hormonal treatment, okay, and that can take a toll on them mentally. So they always, there's a word that, roller coaster kind of emotions that they have, okay, and that. For women, they have at times they have to take some time off work because of that. But saying that, but men too get affected emotionally, especially when there's a treatment failure and all. And most of the time, the men will have to be supportive of the wives, as the IVF process can be extremely stressful. Mm-hmm. So, as for expectations, IVF, unfortunately, or fertility treatment options, unfortunately, is not 100% successful. So most importantly, as doctors, we do not overpromise or give unrealistic expectations to patients and tell them, "Don't worry, 100% you will be pregnant." That's the worst thing we can do. So generally, we have evidence, we have charts which are available and tell you more or less what the success rates in that particular age group or in that particular medical problem that they have. Okay, when we also try to inform our patients, we prepare them. We tell them that you have to be mentally, physically, and third, financially prepared, okay, for the entire fertility journey. So we try to calm them down as most we can, because some of them are very anxious and some even have fear of needles and fear of medications. So as we have been talking, it takes two to bring a beautiful child to this world. So men also need to play a very important role in supporting their wives through the whole journey, and it should not be a lonely journey at all. So everybody here plays a role, from the staff, the embryologists, the nurses, all, and we also have some counselors on board, which will help to to calm patients down and to deal with the emotions.
Let's talk about being financially prepared. Realistically, what should couples expect to set aside for fertility treatment?
Okay. Financial stress is a big issue. Okay, certain amount needs to be budgeted and set aside to use for their fertility treatments. Fertility treatments can be quite costly. At times, it can cost from a few hundreds to even up to 40,000-50,000, depending on the treatment options and plans. There are many ways where they can get money to budget, to finance their treatment, like bank loans, personal loans, which are quite easily available. EPF, initiative by the government, where they can get reimbursement for all their fertility treatment. That was fantastic, and EPF has been really efficient and very, very helpful to all our couples. The income tax rebates, about 6,000 ringgit for the medical treatment, was a good help too. Some patients even have very supportive family members. I remember a few times had patients, who their family members had pulled in the money to help this young couple get their baby. So that was very nice to see. But unfortunately, sometimes there are a lot of, there may be unexpected costs due to other things like surgeries, which a couple need to go through before getting pregnant. For example, I had a couple who had to pay nearly double the cost of IVF because they had to fix certain sperm issues, where we had to retrieve the sperms from the husband's testes. Okay, and another one is sometimes some women tends to have things like fibroids or even cysts, which need to be surgically corrected or removed. So when you end up doing all those things, then the cost can escalate. So it's very important that at the onset, we in the medical side, we give a clear budget to the patient, and patients too have to be prepared to pay a certain amount of money. So it can cost a few hundred to about for about 40,000-50,000 ringgit at times.
So knowing what you'll be facing, and knowing what your options are, that's very important. But as couples are going through, Dr. Navdeep, and I'm sure you'll agree, there's no point in racking up the costs and going through cycle after cycle if nothing is coming out of it, because you're creating a different kind of problem. You said it yourself. The cost is a source of stress on its own. When would you advise couples to sort of pause, take stock of where they are, and then what they where they need to go after that?
Basically, what you're saying is that when they should accept the reality and move on, right? So fertility treatments are not always successful, as what we mentioned. Sometimes it just doesn't happen. We don't know why. Sometimes we have done everything under the sun and it still doesn't work. So globally, it's about 50% of cases work, 50% don't. So when it doesn't work, then we as doctors, we try our level best to assess the situation first, to find out ways and means that with all the technology advances we have and all the knowledge we have, and to try to solve their problem. it can range from a change of protocol, change of medications, or even genetic testing. But when all else fails, where we find the embryos are genetically abnormal, or certain things which the womb is non-favorable for pregnancy, then it's time. That's when we actually have to tell the patient that I'm really sorry, I don't think this can work, and we have to tell them to things like adoption or even other methods will be better. So most importantly, we inform the patient what the odds are against them and what's the success in trying again. We generally at times have to lay out the plain truth without sugarcoating. So that's what we generally do. So when things don't work, after many times of trying, they reach a certain age, like above age of 42 years of age or 45, when she is depleted, when the eggs are already less and a lot of abnormal, sperms or eggs, then it's time that they probably need to, move on their lives and do other things. And that's a very sad situation, and it has happened, and it's very, very stressful even for us to to talk to them about this. Yeah.
And when a couple starts their process of fertility treatment with you, if they come laden with anxiety, perhaps even some depressive symptoms, lots of guilt and shame and blaming each other, perhaps. I'm just laying out the whole gamut of emotional reactions. Would you actually say that if they're so laden with emotional issues, it could affect the success of their fertility treatment, and they should perhaps resolve the emotional part first?
Yes, definitely. Mental health issues can be a contributing factor to fertility problems. The things like when they are upset and depressed, they can be addicted to alcohol, even drugs, to release their pent up feelings. In that kind of scenarios, they're unable to engage in sexual relationship and will cause lots of health problems too. And when a woman is stressed or anxious, sometimes they have increased of certain hormones called like prolactin, and it will cause lots of problems with their menstrual cycle. Even the certain hormones known as the luteinizing hormone to be abnormal too, and that can be detrimental to the ovulation and all. So it's very important for them to get mentally treated in terms of their health issues, their old problems, and if they have not been resolved, should be resolved. So there are many ways that they can go about doing this, basically like counseling, and they are talking to someone about their problems. It's very important too. So yes, they need to resolve those differences and those problems among themselves first.
Have you heard from couples that they get judgment from others around them because they're seeking fertility treatment?
Well, sometimes some couples do say this, that they do have that going on with them, especially when the festival time comes along, like Chinese New Year, Hari Raya, Diwali, when they meet the other relatives or the other siblings, they have children. Yes, of course, then they have that. And that's something which society got to understand. You cannot treat a person that way. They should should be wise enough rather and be mindful when you're talking to a person who has undergone a lot of fertility issues. So yes, of course, it's something which is always there. And about these couples too, they are when they're anxious and and they are depressed, then they should also go for other things, other kind of therapy, counseling, like see a fertility coach, for example, because sometimes when you talk to someone about your problems, they will give you another way how to to look at things. There are many ways how they can solve it by certain there's uplift mind body programs, fertility coaching, hypnotherapy too can help these patients, so they can be less anxious when they are faced with these scenarios.
Fertility coaching, what is that?
Fertility coaching is where we have a fertility coach, Miss Joyce, who helps to talk to patients. Basically, she listens to their grievances and the issues that they're going through. So she will make them look at things more positively.
All right.
Okay, so we've realized that she has been helpful to calm our patients down.
Okay. We have a question here on Twitter who's asking about the cost of egg freezing in Malaysia. I'm not sure whether you will be able to address this.
Yes, egg freezing is done for various reasons. Firstly, in patients who are planning to undergo a cancer therapy, cancer treatment, or even there's something known as social egg freezing. The cost for this will range somewhere around about 10 to about 12,000 ringgit, where we give the lady injections for about 10 days, okay, and then we give them anesthesia, retrieve their eggs from the ovaries, and we freeze them in our tanks.
Okay.
And we can freeze them for how long they want to until they found their Mr. Right.
And then that cost is a one-off cost?
There is a maintenance cost on a yearly basis. It's about 1,000 plus 1,000 a year, because we have to maintain the nitrogen those tanks. Okay, so maintenance fee about 1,000 a year.
Okay, all right. You earlier you mentioned how women when they're going through fertility treatments, it's a process. You'll be going for injections, you're dealing with taking out the eggs and sometimes surgeries involved. Now, I imagine a lot of that may involve time off work for a woman who's working, even if she is a stay-at-home mom. There's so many things that she will have to be able to balance and juggle and need support for. Let's look at employers. I think that's probably a big thing, from the HR side of things. What kind of improvements do you want to see in support for couples going through fertility treatment that employers perhaps could do?
Well, I think that lots of things employers can do. Number one, be empathic. Sympathize with them that they're going through lots of emotional, the fertility journey, and give them some amount of time off. And they should also allocate certain budget or even insurance policies to cover medical expenses. An employer should also be even the other colleagues should be more compassionate to these to people undergoing treatment. And if possible, they should allocate some amount of allowances for these couples to address the issues. Things like what I mentioned was about the insurance policies in particular. Even insurance companies should come along giving certain coverage for young women. For example, if you can buy a policy at a younger age group, so in case you have fertility issues, you can actually pay for it there. So, for example, you have medical illness cover. You have a medical card that covers heart diseases, cancer therapy, cancer treatment. It's not like you will get cancer or you predict that you might get cancer in future. No, it's just an insurance policy where if in case you need to use it, then you can. So that will reduce a lot of financial burden on the people. Okay, and if possible, some employers also can have this kind of things in place where they can have an X amount. There's some companies which in the US do, but have X amount of funds to help women to go through fertility treatment.
What's currently available in our insurance landscape?
Well, we number one, infertility is not covered, unfortunately. Okay, so if you're going for IVF, for example, then you have to pay it by the whole thing by yourself. Okay, and that's not covered. The only things which are covered are gynecological problems like fibroids or ovarian cysts or polyps, those surgically correcting those kind of diseases or abnormalities. Yes, that's covered by insurance, but not fertility treatment.
All right. Do you have a final message for us, Dr. Navdeep, about the impact of infertility on mental health?
Well, mental health, as you can see, issues due to infertility is becoming more prevalent these days, and the inability to get babies has caused lots of stress, depression, anxiety. So a couple going through this psychological distress due to infertility should, at times acknowledge their feelings too, so they shouldn't brush it aside. So if you're having that kind of feeling of depression, anxiety, it's always best to, highlight your medical team that you're having this, so at least the medical team can help you to solve the problem before it becomes an issue. Okay, and as for couples who've been trying and you feel overwhelmed, then maybe they should stop the treatment for a while, take a break, okay, and take a break and start back after a few months. And as for society, yes, please be more mindful when you speak to couples undergoing fertility treatment. Okay, so that's something which I feel that it's important for all our listeners to follow.
Yes, because at some point or other, we do come across friends and relatives who probably are trying. You don't know what's going on in their lives, and unkind or harsh words don't help, do they? And thanks for the valuable reminder about just acknowledging and accepting your emotions, and knowing when sometimes you need to stop and take stock of that and deal with that before trying again. I've been speaking to Dr. Navdeep Singh Pannu, Medical Director at TMC Fertility, and we've been discussing the impact of infertility on mental health. You've been listening to Health and Living, BFM 89.9.